Hi everybody, Dr. Corey here with Advanced Spine Joint and Wellness. So one of the big questions we get quite often with new patients or even existing patients in our office is what do we do for or why am I having numbness, tingling, or pain or just weird sensations down my legs? It's a good question because it definitely shouldn't be there. So first and foremost, we have to diagnose, well, why is it occurring? There's a lot of different reasons that it could be happening and a lot of variables to consider, but taking it down to the basics, we want to look at the structures around the spine and the spine itself. So first and foremost, if we zoomed in on our lumbar spine, we want to look at those big old juicy discs that are in between the bones. We call those intervertebral discs. Those are important because they act as not only cushions between the bones, because bones clanking together is never going to be a good thing no matter where it's at, but it also more importantly creates a large space where the nerves that come out of the spine and run down the legs and all over the body go. It creates a nice space for them to travel. So not pinching that nerve, not squeezing down on it on a consistent basis, and it's functioning at its peak and where it should be, so no problems. So some things we see that could be causing that numbness, tingling, or pain that you're having is something on the more severe side in a sense of, truly really bad degenerative disc disease. So that disc is completely flattened out. We've got some gnarly arthritis going on, and that space where the nerve is coming out is a lot smaller. So intermittently or consistently throughout the day, we could feel those sensations down the legs because that nerve is getting pinched off. For those that come in that have had an injury, whether it be a sport, doing something fun, like falling off a scooter or working out and lifting something heavy, we could also develop something called a disc bulge or herniation. So what that means is that disc is not truly degenerative, but we've had an injury where now that disc is pushing out. That is not good. That is going to pinch that nerve off, causing a lot of issues. And the only way to fix that is to get pressure off the nerve. Well, how do we do that? Well, at our office, we are a true integrative medicine office. So we work with chiropractic, physical therapy. We have great decompression tables, laser therapy, cryo to calm down the inflammation. All of those with the main goal of taking pressure off the nerve, getting the body to heal, and making sure we stabilize so these issues don't persist or return. Because you don't want a bad disc, you don't want a disc bulge, and more importantly, we want to do our best to avoid surgery. Is it sometimes an option that needs to be done? Yes, but we want to exhaust all the options before until we need to get to that point. And here at our office, we do a great job at doing that. We do a great job at taking care of you guys and getting you back to being pain-free and living life. So if you're experiencing pain in the back, radiating symptoms down your legs, call us. We'll take care of you.